Well, hello and welcome to HealthLine this Tuesday evening. I'm Jennifer Blomquist. I have the privilege of hosting the show. I know we have a lot of regular viewers out there, so thank you so much to all of you for tuning in again. We always appreciate that. And maybe you're a newbie to our show. And if you are, I just want to run through how this works. If you're one of our regulars, I apologize. You probably already know all this stuff. But still a good reminder that we are live here in the program, or here in the studio. It's a live program, and we welcome any questions that you may have. We have an orthopedic surgeon with us tonight, and we're going to be talking about joint replacement surgeries, maybe some things you didn't know about it. Maybe you have an issue. Maybe somebody you care about has an issue that you would like to ask a question about that. So here are some options for getting those questions answered. Best way, my favorite way, is just call. We keep the phone number at the bottom of the screen throughout the program. It's 969-2720. If you're outside of Fort Wayne, it's still a toll-free call as long as you dial 866 in front of it. Call in. You talk to a very nice call screener. They will not throw you on the air. I promise that. They will talk to you and give you a couple of options. You can ask your question live. That's what I prefer if you feel comfortable doing that, because our guest might need some more information from you, and you guys can talk back and forth, and that's a really great way to get your question answered. You are welcome, though, just to relay your question to the call screener. They'll let us know, and then we'll get it answered for you. And then, of course, just this past winter, we started the texting line. So that's a little different number, 969-2730. If you feel comfortable, put your name and where you're calling from or where you're texting from. And I want to assure you that your phone number does remain private. No one's going to see your phone number. It does not come up on the screen. So without further ado, I'm going to introduce you to our guest tonight. He has never done a show with us, so I'm excited to have him, Dr. Roy Small, and you are an orthopedic surgeon. So thank you so much for coming on.
Absolutely excited to be here.
Appreciate it. People, we've had many of colleagues in your profession come on before, and I always like to preface it with, just because you go to see an orthopedic surgeon doesn't mean they're going to do surgery. I know the desire is to start as conservatively as possible with treatment. So I don't know if you want, if somebody's got issues, are there other things you can exhaust before resorting to surgery when it comes to joint replacement?
Yeah, absolutely. I mean, I talk about this with every patient that comes to see me. We always start with imaging to see sort of where the baseline is at, how bad is the arthritis, how bad is the joint. For me particularly, I focus on hip and knee replacements only, so the majority of my patients I'm seeing do have hip or knee complaints. So we often start with imaging. It's usually, if it's bad arthritis, it's quite obvious on x-ray, but if we need more imaging, we'll then get an MRI. Okay. And always we begin with conservative treatment options. So start with activity modifications, sort of modifying how you're using your joint or the things you're doing to be active so it's less painful for you. Anti-inflammatory medications, weight loss, of course, steroid injections. We also do hyaluronic acid injections. So a whole slew of non-operative treatments that are fairly easy to do, either at home or in our office. And
do you find that I mean, we always, I think, associate arthritis and joint pain with an older individual. If you see any commercials on TV for different products, whether it's like one of these ointments, it's usually an older person. But I feel like people are so active, especially like my kids, I feel like are much more, their athletic programs and things were so much more demanding, and they're year round. So I'm wondering if you're seeing younger people, with these issues.
Absolutely, we do, and arthritis we know has a genetic component to it. It often it tends to run in families, so we do see it in younger patients all the time. Just routine osteoarthritis. There's also a lot of other reasons we perform joint replacements. So for other conditions, sometimes developmental conditions that people are born with, that can require doing either a hip or knee replacement at a much younger age.
Now, if you exhaust all the conservative venues and surgery is looking like your best option. I was surprised. I didn't realize that, especially when it comes to the knees, which I know that's one of your specialties, that you can do a partial knee replacement. I thought it was, just the whole thing. So is this a new newer concept, or?
It is. Partial knee replacement has actually been around for a long time.
Okay.
Robotic-assisted partial knee replacements, which I perform, has not been around quite as long, perhaps the last 15 years or so, and has really become mainstream over the last 10.
Okay.
But it does allow, really the knee joint is made up of 3 separate compartments. You have the medial or the inside compartment of the knee, the lateral or the outside, and then the patellofemoral, the kneecap joint as well. And actually any one of those 3 joints can be replaced individually. So some patients, for example, the most common is the inside compartment of the knee, which is the most common place to develop arthritis. We can actually just resurface the inside part of the knee, which is done all robotically. It's much less invasive than a full knee replacement. You get to keep a lot of the ligaments on the inside of the knee. The ACL stays, which is normally removed for a full knee replacement. So it's a faster recovery. The motion is a little bit more natural and normal after that type of a surgery, and you get back much quicker. It's really around a 6-week recovery versus 3 months.
I was going to say I've only personally known one person who had knee replacement, and it's a tough surgery to recover from. I mean, it was it was an older gentleman, but granted, but still, I mean, he said he would never do it again after he was going to have his other one done. He had some other health issues too, which may have exacerbated it. But yeah, that's something that you had to, I would think, kind of mentally prepare for.
Absolutely.
Now, when you talked about the 3 different parts of the knee, is it possible that you replace one and then maybe another section needs attention down the line, or is that unusual?
It is possible, and that's why it's picking the right candidate for a partial knee replacement is very important, because I tend to reserve those for patients that have very little to no arthritis in the other compartments. If you have 2 compartments that are showing arthritis, then it's often best to do a total knee.
Do the whole thing. So the other thing you touched upon, the robotic surgery, and I wanted to talk about that. I remember years ago doing a program with an OBGYN surgeon, and there was definitely some hesitancy on his part about embracing the robotics. I mean, this is going back 15 years ago probably. But now you're hearing a lot more about it, and I feel like it's here, in Fort Wayne, so you don't have to go to a bigger city to have it done. But some people might be a little scared and think, what is this robotic surgery, and how much control do you have as the surgeon over what happens?
Yeah, it's a great question, and it's often a misconception too.
Yeah.
So with the robotic platform, or the type of robot that I use, it really helps throughout the phase of care. So preoperatively, I get CT scan of the hip, knee, and ankle when I'm doing a knee replacement surgery. It allows me to create a 3-dimensional model of the knee that we can then plan out the surgery prior to the patient ever hitting the operating room. Then during surgery, the robot, or as we call it, it really is a guided saw tool that allows us to make very accurate, very precise bone cuts, but it's all being performed manually. So it's really all the robot does for us is helps us with the planning and then the execution of the actual bony resection. And then in the case of the partial knees, it's actually a burr tool that just kind of carves out the very specific area that fits perfectly with the implant, but it does it with sub 1 millimeter accuracy, which is it's obviously hard to be that accurate any other way.
Yeah, I mean, years ago, I remember wasn't it just like if you had a knee replacement, total knee replacement, it was a scar all across your knee.
Yeah.
So now it sounds like, I mean, is there even any stitching that needs to be done?
It's still a fairly large incision on the front side of the knee for multiple reasons. But a lot of times, especially with the partials, the work on the inside is a lot smaller. But still with the totals, it's still a big procedure, still an open procedure with the enhanced accuracy and objective data measurements you can get from the actual platform, the robotic platform.
All right. We're going to talk more about knee replacements and all kinds of joint replacement surgeries, but I did want to remind you to call or text in a question. Again, it's 969-2720 is the phone number if you want to call us, or you can text, which somebody did. It's 969-2730. We got a text from a guy named John from Fort Wayne, so thank you, John. You touched on this a little bit, Dr. Small. He's asking about, how long does it take to recover from total knee replacement surgery? I don't know if you want to talk, you said up to 3 months, but you're not just sitting around for 3 months. That's why they don't let you sit anymore.
No.
And is it, you know, I guess I didn't think about this. Is it even outpatient?
It is.
It is.
Yep.
Okay.
Yep.
I didn't know if you had to stay overnight or not for it.
No, that's an excellent question. So overall, my answer I give to that is it's around a 3-month recovery period. That being said, the majority of our surgeries are performed same day now. So you come in, you have surgery, you go home the same day. You're up walking right away after surgery.
That's hard to believe.
It is. We begin
Even
physical
with that,
therapy.
do you need crutches though?
You
usually?
start on a walker.
Oh, okay.
And then usually patients will progress from a walker to a cane within the first week or two, depending on their comfort level.
Yeah.
And we start physical therapy between days 3 and 5. So that's when you're kind of getting started moving the knee again, getting the motion back. A lot, arthritis and stiffness often go hand in hand. So the knees are tight and stiff prior to surgery. So we try our best to get that motion back relatively quickly. The first 2 weeks, I usually tell patients it's really all about rest. You're resting the knee, icing the knee, keeping it elevated, keeping the swelling down. Weeks 2 through 6 are about getting that motion back and mobility back, getting back up on your feet. The dynamics of your limb tend to change. So, for your brain to get used to that takes a little bit of time. And then weeks 6 through 12, we really focus on strengthening, getting that quad strength back. So most patients are really through the recovery period by 3 months. And then really I say from 3 to 6 months is where we kind of go above and beyond. You get your knee back to being strong again, back to your normal gait cycle, back to your normal activity levels. So that the full recovery, the real answer would be honestly up to 6 months. But I think in general, you're doing most things by that 12-week mark.
And I've heard this, another thing I've heard from some of your colleagues is people will come and say to the physician or surgeon, they'll say, so do I need the knee replacement? And the doctor is usually saying, you tell me, if it's, I mean, I guess if you had like a horrible injury or something, that'd be a different story. But, another one of your colleagues had said something like, if you're to the point where it's, hindering your everyday activities or you feel like you're missing out, that's kind of, the guideline he gives to patients. But some people will tolerate the pain, they'll put it off.
They're all great points.
Is there any danger to putting it off?
There is. So,
there is.
It's all great points, and I say the same exact thing. I mean, a joint replacement procedure is an elective procedure, and I say to every one of my patients, a surgeon should never tell you you need a joint replacement.
Okay.
There are a few caveats to that. Cases where you're starting to get bone loss, where the arthritis is so bad, not only have you worn through the cartilage, but now the bone is starting to change. Those cases, I say maybe we start to think about it sooner rather than later.
Okay.
The other case is if the knee is getting very stiff. So if you're starting to not be able to straighten your knee, really with maybe a 20 or so degree lack of full extension, then maybe we start thinking, okay, might be time to consider a joint replacement. But in general, absolutely, we try all the conservative non-surgical measures first. Until those have failed, then we consider joint replacement.
And can you talk about the kind of hardware that would go in a person's knee? I picked up we had a doctor on this past year that brought some of the hardware. Holy cow. I mean, it was like some heavy duty stuff. Yeah, I was surprised by the weight, but also, I mean, it's solid. So, I mean, in general, can you expect to just need that kind of surgery once? Even if you're a younger person, could that last forever? Or I mean, for your lifetime, I guess.
Right. So in general, it's different for the hip or the knee, but in 30 years, our data tells us that the survivorship is excellent. It's more than 90% for hip or knee replacements. So for the vast, vast majority of people, you have one joint replacement procedure and it's it. You're done for life. As far as the implants go, they have some weight to them. They're no doubt. It's a metallic implant. We have newer materials now, newer implants and press fit implants that don't utilize cement. They're actually sort of wedge fit or press fit into the bone, and then your own bone can grow onto them. Those are actually quite a bit lighter. Most of them are made of like a titanium alloy. But in general, there is some weight to the implants. No question.
Yeah, so you feel like you have to go on a diet after your surgery.
Right.
But like you kind of touched on that too. There are things, I have also met people that probably would have were on the road to needing, knee replacement, but they, just that was kind of like being in pain and uncomfortable. That was kind of what they needed to push them into losing weight and getting more active. And it's amazing just how much better you feel and how much it can help you physically. So I don't know, have you ever met any patients that have been successful in avoiding surgery just out of
Absolutely,
weight loss?
I have. Yeah,
Okay.
absolutely, I have. I mean, especially if you're kind of in that category where it's moderate to severe and it's still somewhat tolerable. It's not exactly reversible, but you can slow the progression.
Yeah.
These activity modifications, weight loss, physical therapy, injections. I mean, I've had patients 5 years down the road and still with their native parts, which I think is always the best way if you can.
Sure. And this is a great time of year to go on a diet, really. There's so much good. I mean, there's fruit and vegetable stands around, and produce is so much better. And I know, and the weather, I mean, you can get out and walk around and not freeze to death. So, it's a good time of year to start an exercise program. Maybe I will even do that. So, can we talk about the hip replacement too? Because we've done some programs on that. I cannot believe that, because hip replacement seems like a big deal and to me, and I'm shocked that those patients are out of bed at like that day. Is that ever done outpatient, or is that still at least a one-night hospital stay?
No, 90, especially with the anterior approach hip replacements, 90% of my patients are out same day, up walking same day. In general, the recovery is a little bit easier after a hip replacement than a knee replacement. There's a few reasons for that, but similarly, same day procedure.
You said anterior, which means the front. So did they used to go in the back, posterior?
Exactly. So really multiple ways to get in through the hip. The two most common in the United States today are the anterior approach, which is through the front part of the thigh, and then the posterior approach, which is more from the side. It's been somewhat of a paradigm shift in orthopedic surgery over the past 10 or so years to our last poll at the hip and knee replacement annual meeting. The last poll showed that more than 50% of the audience was performing the surgery from the front. So, and that's the first time that that's ever been. It started around 10 years ago. It was only about 10% of the hip replacement surgeries.
Wow, so
it really has been a drastic shift,
And that is something you can do the robotic surgery with as well?
Very similarly. Two different types of technology in the hip side, robotics and navigation, which is getting into the weeds a little bit, but the main difference would be that the robotics uses that big arm that I was talking about to help perform the bony resections. Navigation, which is the technology that I utilize currently, is more X-ray based. So the whole surgery is done under fluoroscopy or during surgery X-ray. And it gives us sort of exact measurements of where the components are going, the leg lengths, the offset, different numbers we look at that are very important for hip stability. All done via X-ray. So it's all sort of multiple screens and an X-ray machine, and then the rest of the hip replacement is done freehand.
So for those patients, how many months would they expect to be, doing physical therapy and recovering? I mean, what did you say with the knee replacement? Is it day 3 through 5 you start physical therapy?
Exactly. With hip replacements, especially the direct anterior approach, I actually routinely do not use therapy after hip replacement surgery.
I didn't know that.
It's usually not necessary. The first couple of weeks, sort of similar to the knee, I say just rest, not a ton of walking, like you getting up and moving to get the blood flowing. But really, weeks 2 through 6, you're kind of recovering on your own. And then after week 6, in general, hip replacement is about a 6-week recovery. So usually after week 6, I get some x-rays in the office, make sure the implants are looking okay. And then no restrictions. Whatever's comfortable for you to do, you're welcome to do it.
That's amazing, because I realize the knee is a pretty big deal, but hip as well. I mean, it's holding on to a lot of, or a weight-bearing area of the body for sure. So, we have less than, I know we're down to probably about 5 minutes left in the show, but that is more than enough time to take questions. Please give us a call, 969-2720. Also, you can text. We just got another text from somebody. I'm going to get to that question, 969-2730. 888-938-3630. So I have never heard of this, Dr. Small, but Anna from Fort Wayne is asking, have you ever heard of, is it Jiffy? Is that, okay, I couldn't see the whole word. A Jiffy knee replacement. I have never heard of that, but. I
have, and that's an excellent question. We actually get a lot of questions on this one. The Jiffy knee replacement, they've done an excellent job with marketing. So a lot of patients have heard about it. It really is a very similar knee replacement in terms of like how the knee implant goes in, the type of knee implants that are utilized, the recovery protocol, recovery period, all very, very similar. Really what's unique about the sort of Jiffy knee replacement is the approach that's utilized. So they promote a quad sparing approach to the knee, which can be performed in any knee replacement. I routinely perform the quad sparing approach. And I also, with my partial knee replacements, all get the quad sparing approach. So in general, when we look at the literature, it seems like about a 4 to 5 day faster recovery, which can be beneficial in some cases, but there can be some drawbacks to that as well.
Is that something, I guess they would just have to consult with a surgeon? I don't know if would you say it's becoming commonplace?
It is becoming common. I get that question a couple times a day, for sure.
All right. I must have missed that infomercial or something
You'll see it
along the way. So, all right, we did get another text question. Please, I apologize if I'm not pronouncing this correctly. I think it was Bays from Fort Wayne. Can you go back to sports after having a knee replacement? I'm curious to hear that question.
Another excellent question that I get a lot. The answer is absolutely yes, you can get back to sports after a knee replacement. I encourage it, actually. And I think we do knee replacements for a reason. It's to get people back to doing what they like to do. So if you have something you enjoy doing, whether it's pickleball or downhill skiing, I have a lot of patients that downhill ski, that water ski, that are very active in the gym. So absolutely you can. Particularly after the partial knees as well. I mean, after partial knee replacements, I don't even really talk about restrictions. So you can do whatever you want on a partial knee replacement.
Wow, that is amazing. We have a few more minutes left, I should say. So if you have another question, feel free to call or text it in real quickly. But I did want to ask you, especially, one thing I've talked to some of your colleagues is about being a parent of 6 children. Sports is not just, it's not just at the local park district like I did for 6 weeks you play softball, and then you don't play softball again until next spring. It's if you want to do a sport and you want to play at a high school level, you've got to do it year round. And it's hard, especially when you get to the high school level. Being a multi-sport athlete is nearly impossible. There are some kids who pull it off, but I just have to think that when I see these kids are constantly, they're working out hard, they're at their practices, it concerns me as a parent from an orthopedic standpoint. And I'm thinking of arthritis and joints. Like when they get to college age, are they not going to, feel good? I don't know if you share that concern, if you see a lot of cases like that.
It is true. The majority of the times where sports or physical activity would lead to arthritis is often after an injury. Our bodies are very resilient. The ligaments are set up and created to sort of protect the knee and to have the motion be a certain way and to protect the cartilage. But when that goes awry is often after an injury. So they have been shown, it has been some studies on looking at single sport athletes that maybe have a slightly higher increased risk of injury secondary to repetitive motions that they're going through. But in general, I always encourage physical activity, always encourage sports participation. I think it's protective for your joints, if anything.
Okay, good to know. Maybe I should worry less. I'm going to try and squeeze in one more quick question. So John from Fort Wayne, I don't know if it was the same John, but if it is, hey again. He's wanting to know, is stem cell therapy a good alternative to hip replacement?
Another great question that I get these often.
Tonight.
Stem cell therapy, unfortunately, there is not good literature to support stem cells. There is a lot of financial money and studies going on in this field, but nothing that we have now that can replace cartilage. And I think that's the most important thing. Once the cartilage is lost, we don't have any way to really put it back on or regrow it. Pre-arthritic disease, potentially there's some new things coming out that could help slow the progression of arthritis or reduce the inflammation within the joint that can help pain. But unfortunately, with the stem cells, we're not there yet. But hopefully someday.
We've had a lot of people in all different, specialties will call in and ask about stem cells. So I mean, like you said, there is a lot of research going on, and it's amazing just even in 5 to 10 years how things can change. So stay tuned. Come back sooner than 5 or 10 years old. We'd love to have you back on. So again, this is Dr. Roy Small. Thank you so much for joining us this evening. Really appreciate it. So, and so many thanks to all of you. We have such great viewers. You guys come up with great questions. I really appreciate that. So take care. We are going to have another HealthLine here next week. I don't know the topic yet, but I will find out. It'll be a great show. We have wonderful guests. So take care. Enjoy the rest of this week, and I will see you back here next Tuesday night. Bye-bye.
The preceding program on PBS Fort Wayne is made possible in part by